Today we are going to be discussing mood disorders. I would just like to start off with one question. How many of you have felt depressed after failing an exam or not being accepted into your first choice at UE, or maybe a lot more relevant to you, breaking up with a romantic partner? For many of us, we have felt depressed from time to time. However, mood disorders involve much more severe alterations in mood for much longer periods of time. In such cases, the disturbances of mood are intense and persistent enough to be clearly maladaptive and often lead to serious problems in relationship and work performance. Looking at the picture on the screen, we can see that Dr. John is entering the psychiatric ward to treat his patients with mood disorders. Let's enter his office. In this session, our main objectives are to define mood disorders by identifying the two key moods, to describe the two main types of mood disorders based on the DSM-5 criteria, to explain the key features of major depressive disorder and persistent depressive disorder, to compare and contrast bipolar 1, bipolar 2, and cyclothymic disorder. I would now like to pose a question at you. What are the two main moods? The picture should help you identify them. Take 10 seconds to write them down. So let's see what you came up with. I assume that everyone has mania and depression. Mania is often characterized by intense and unrealistic feelings of excitement and euphoria, while depression usually involves feelings of extraordinary sadness and rejection. Some people with mood disorders experience only time periods or episodes characterized by depressed moods. However, others experience manic episodes at certain periods and depressive episodes at other time points. Normal mood states can occur between both types of episodes. Manic and depressive mood states are often conceived to be at opposite ends of a mood continuum, with normal mood in the middle. So while this concept may be accurate to some degree, sometimes an individual may have symptoms of mania and depression during the same time period. In these mixed episode cases, the individual experiences rapid alternating moods such as sadness, euphoria, and irritability, all within the same episode of the illness. So what then are mood disorders? Let's define mood disorders. A disturbance of the mood sufficiently intense to warrant professional attention. It involves extremes of emotion, intense, persistent, and maladaptive disturbances. And also, mood disorders co-occur with other psychiatric disorders. So let's look at the DSM-5 and how it categorizes mood disorders. The DSM-5 lists two main mood disorders: depressive disorders and bipolar disorders. With depressive disorders, only depressive episodes occur. The person experiences profound and intense sadness. The disorder's essential element is an unusually elevated sad mood known as dysphoria. On the other hand, bipolar disorder, a person has episodes of both mania or hypomania and depression and or mixed episodes. Mania is described as a period of abnormally excessive elation and euphoria. Hypomania is defined as a less severe and less disruptive version of a manic episode. So let's look at depressive mood disorders. The DSM-5 listed four main depressive mood disorders. For the purpose of this class, we will examine the first two: persistent depressive disorder, formerly known as dysthymic disorder, and major depressive disorder. Before we even do so, let's look at some of the major symptoms of depression. So as you can see on the screen, this little buddy is depressed and experiences a wide range of symptoms, which include persistent feelings of sadness, feeling hopeless or helpless, having low self-esteem, loss of interest in usual activities, difficulty with relationships, changes in appetite or weight, sleep disturbance. As you can see, little buddy cannot sleep. He's experiencing insomnia. Fatigue, he's very tired. His friends are asking him to hurry up. Lack of concentration, and very importantly, suicidal thoughts or attempts. So with persistent depressive disorder, one of the depressive disorders, persistent depressive disorder is a chronic mood disorder where a person reports a low mood almost daily over a span of at least 2 years. The symptoms are not as severe as those for major depression, although people with persistent depressive disorder are vulnerable to secondary episodes of major depression. Persons with persistent depressive disorder do not meet the criteria for major depressive disorder. Despite persons with persistent depressive disorder do not experience all the symptoms of a major depressive episode, they are never free of their symptoms for longer than 2 months. And they also experience intermittent, normal moods that occur briefly. However, with major depressive disorder, also known as clinical depression, a person has one or more major depressive episodes. After a single episode, major depressive disorder would be diagnosed. The diagnostic criteria for major depressive disorder requires that the person exhibit more symptoms than are required for persistent depressive disorder. An affected person must experience either marked depressed moods or marked loss of interest in pleasurable activities most of every day for most days for at least 2 weeks. Individuals with major depressive episode or major depressive disorder are at a greater risk for suicide. So we've just looked at depressive mood disorders. As we are still in Dr. John's office, let's look at the other mood disorder, bipolar disorders. With bipolar disorder, it can be described as alternating periods of mania and depression. The subtypes of bipolar disorders are cyclothymic disorder, bipolar 1, and bipolar 2. Let's take a look at cyclothymic disorder. With cyclothymia, a form of bipolar disorder, it consists of recurrent hypomanic and dysthymic episodes, but no full manic episodes or full major depressive episodes. A history of hypomanic episodes with periods of depression that do not meet the criteria for major depressive episodes. So there is a low-grade cycling of mood which appears to the observer as a personality trait and interferes with functioning, lacking some of the severe symptoms and psychotic features of bipolar 1 and 2 disorders. So to meet the diagnostic criteria for cyclothymia, a person must experience this alternating pattern of emotional highs and lows for a period of at least 2 years with no more than 2 consecutive symptom-free months. With bipolar 1 and bipolar 2, bipolar 1 is distinguished by the presence or history of one or more manic episodes or mixed episodes with or without major depressive episodes. A depressive episode is not required for the diagnosis of bipolar 1, but depressive episodes are often part of the course of the illness. Mixed episode includes both depressive and manic symptoms. On the other hand, bipolar 2 does not include full-blown manic or mixed episodes, but does include hypomanic episodes. So what's the difference? A person with bipolar 1 has manic episodes, while someone with bipolar 2 has hypomanic episodes. So let's summarize what we have just done in this session. In this session, we have defined mood disorders, described depressive and bipolar disorders, explained the features of persistent depressive disorder and major depressive disorder, and finally, we have described each of the subtypes of bipolar disorders. This takes us to the end of the screencast session on mood disorders. Take some time to go through this session again and attempt the questions on your tutorial sheet relating to mood disorders. We will discuss these questions at our next face-to-face class in week 8. Thank you. I do hope that you enjoyed the screencast.